medical self-help is an emergency measure to be used only in cases of sudden or extraordinary misfortune. If people require medical care in the course of normal, everyday living, they should always be treated by a doctor. However, when disaster strikes, you may not be able to obtain trained medical aid in time. There are many forms of disaster. They can happen to you and your family at any moment. This film is one of a series on medical self-help. Its purpose is to teach you what to do in an emergency situation when there is no doctor.
At a time of major disaster, the proper handling of injured persons at the scene of injury is a major responsibility of rescue workers. Some casualties may not require any immediate medical aid and can be transported safely to a place of shelter. Other victims must not be moved until emergency medical aid is given. Among these are persons who may be suffocating or who may have a hemorrhage. Another injury which must be attended to before moving a person is a fracture. Fractures may comprise the greatest number of injuries following a major disaster. This wall might collapse. In other situations, it might be danger from fire or an explosion or a live electrical wire. Do not lift the victim. Drag him to safety, but do not move him any further than absolutely necessary. If he has a fracture, any movement of the involved part may cause additional injury. This is the first rule in treating a fracture victim. Do not move him except to drag him away from immediate danger. How do you know there is a fracture? In many cases you cannot be sure, but in every case where a broken bone may have occurred, you must assume it has occurred and handle the situation accordingly. If you must remove the victim's clothing in order to examine the injury, cut the clothing away rather than lift or move the limb. Inspection is necessary, however, in order for you to determine what type of fracture exists and to decide what immediate steps must be taken to prevent complication. Here is one type of fracture, a simple fracture of the long bone in the upper leg. A simple fracture is one in which the broken ends of the bone do not penetrate the skin. But note that the broken ends of the bone are jagged and sharp. Any movement of the leg may cause these two jagged ends of bone to cut into blood vessels or nerves which run alongside the bone. For this reason, a person with a fracture or suspected fracture should never be moved until the fractured limb has been splinted. Splints are any suitable objects which provide support for the fractured limb and prevent it from bending at a joint or a fracture site. Remember, a simple fracture is not a harmless fracture. There's no such thing. In any fracture, the movement of jagged edges of bone may cause additional serious injury. This is a simple fracture of the upper leg. As in most cases, there is swelling and discoloration. but the skin is not broken, so you do not have to worry about controlling bleeding or preventing infection in this case. But in every case of injury, there is the danger of shock. This is especially true if there has been much blood loss or extensive injury to tissues and bone. If shock has occurred, immediate anti-shock measures must be taken. However, if the victim does not appear to be in shock, keep him warm and quiet, and reassure him that everything possible will be done to relieve his pain, and move him to shelter. The splints must be tied securely at several points, but never over the fracture. Use any available material to make the ties, such as belts, strips of blanket, or clothing. It is also important to avoid binding the leg so tight as to cut off circulation. Remember, the victim may have to wear the splint for as long as 2 weeks without getting professional medical help. Secure all the ties with square knots to prevent them from slipping. Splints should be padded with some soft material, wads of clothing or strips of a torn blanket, burlap or newspapers, or even grass. Padding makes the splint fit better, holds the fracture in better alignment, and makes it more comfortable for the victim. When the splint is completed, examine the toes to be sure they are not turning blue. If that occurs, loosen the bindings. Keep the victim warm and as comfortable as possible. Under the circumstances, you can do no more for a man with a simple fracture. However, in a compound fracture, when a broken bone penetrates the skin, there is more you can do, more you must do. This is a compound fracture. In this injury, a broken end of the bone has penetrated the skin. It is an open wound and may result in immediate shock or in ultimate infection. Either of these complications may cause death. What must you do first? First, prevent shock, since this is an immediate threat to life. To prevent shock, lower the victim's head, cover him to conserve body warmth, and keep him quiet. Your second responsibility to the injured man is to help shield the wound from further contamination. To do this, cover the exposed segment of bone with a sterile dressing. If you do not have a sterile dressing, use any clean piece of cloth. Avoid touching the exposed bone or the open wound with your fingers. Before the injured person can be moved, his leg must be splinted in place. This is essential to prevent further damage to the leg as well as to minimize pain. Remember, pain contributes to shock, and you must try to prevent the victim from suffering further pain by handling him gently as you pad the splints and secure them to the fractured limb. When the fractured limb has been splinted, the injured person must be moved to a place of shelter. Bear in mind the need to handle him gently to combat shock. When using an improvised stretcher, make sure it is strong enough to support the weight of the injured person. When carrying an injured person, the rear stretcher bearer should walk out of step with the front bearers. This prevents jogging the victim and aggravating his pain. Keep his head low. Keep him warm. Since shock may develop hours or even days following injury, anti-shock measures must be continued after the victim has been brought to shelter. He should be kept lying down and protected against chilling. For people with open fractures, additional precautions must be taken to prevent or minimize the risk of infection. An infection of bone can lead to loss of the limb or of life itself. One way to help prevent infection is to irrigate the open wound with saline solution, sterile water, or plain tap water. Irrigating an open fracture wound will flush away foreign material and bacteria and help to keep it clean. Make sure the solution rinses out the wound and does not simply flood it. Since this is an open fracture and the broken ends of the bone are badly out of alignment, an attempt must be made to return them to near normal position before muscle contraction produces even further malalignment. This requires that traction be exerted on the injured limb in order to pull the exposed end of the bone back into normal or near normal position within the limb. Ideally, traction is applied in a hospital. But this is not a hospital, and there are no doctors and nurses. This injured man can be helped only by rescue workers knowing what to do and what not to do under the circumstances. If the bone has penetrated the skin or there is an obvious deformity caused by the malalignment of the bone ends, you may be able to reposition them to near normal alignment by gentle manual traction. But never attempt to do this alone, and never force traction. Forcing traction may cause additional injury to the leg. To be effective, traction must be sustained after the limb has been splinted. If the limb has been extended to its normal length without difficulty, it can be sustained in traction with this simple device: a few twists of cloth which secure the victim's foot to the extended tips of the splint under slight tension. Your responsibility to the victim of a fracture is to immobilize the limb, transport him safely to a place of shelter, and do all you can to prevent infection. In so doing, maintain continuous countermeasures against shock. It would be useless to do a good job on the fracture if the victim were subsequently to die from that complication. Any bone in the body may be fractured with varying degrees of severity and complication. The bones of the skull, chest, and hips may be crushed inward, damaging the organs and tissues they are intended to protect. Other bones, such as the spine, arms, and legs, may be broken apart in one or more places, damaging blood vessels, nerves, and other tissues which are adjacent to them. In every fracture, or suspected fracture, a basic rule applies. Immobilize it. How you do this depends on the type of bone and its location. The long bones of the arm, like those of the legs, are best immobilized by splinting. Although a person with a broken arm may be perfectly conscious and want to get up, do not let him move, and do not move him until you have examined his injury and made a splint for it. This victim has a simple closed fracture of the bone in his upper arm. You can't determine this by the appearance, for there is little deformity and no swelling or discoloration. But the arm is painful to move, and the victim has been exposed to violence. You must assume the arm is fractured and act accordingly. Make a splint for it. An emergency splint for fractures of the arm can be made with boards and bindings. If the upper arm is fractured, make sure the binding material supports the arm above and below the fracture site, and that it does not cut off circulation. The lower arm should be supported in a sling, which you can make out of any soft material or the victim's own shirt. A sling will also temporarily support a fractured lower arm. These are quick emergency methods for handling simple fractures of the arm. Many fractures cannot be immobilized by the splinting methods used for the long bones. Among these are fractures of the hip, ribs, and skull. Nevertheless, fractures of these parts of the body must be immobilized to prevent bone ends or fragments from causing additional serious injury to the vital organs they contain. A person with a skull fracture may be conscious or unconscious. There may be bleeding from the mouth, nose, or ears, or none at all. There may be an obvious injury to the head, or none at all. If conscious, there are often signs of nervous disorder. If a victim is found in any such condition, there are certain do's and do-nots that may save a life. Do control bleeding by elevating her head slightly. Do make certain she's breathing adequately. Do not leave a skull fracture victim alone, and do not attempt to move her by yourself unless she's in immediate physical danger or no possible assistance can be obtained. This child has suffered a fracture of the jaw. If necessary, use your finger to clean out her mouth. The greatest danger is from choking on broken teeth or blood. You cannot set this fracture, but you can provide some immobilization by placing a broad strip of cloth under her chin and easing the jaw gently into normal alignment. Do not force her teeth together. Do not tie the bandage too tightly, or the victim may find it difficult to remove if she needs to vomit. That might result in her choking to death. Do not tie the support with a square knot. Use a bow knot with long ends hanging loose, which the victim can grasp in a hurry. Among older people, fractures of the pelvis or hip are common and often result from a simple fall. complains of pain and immobility of the hips and pain radiating down one or both legs, you must assume that a fractured pelvis may be the cause. If no other fracture is suspected, gently place the victim on her back, with the knees slightly bent and supported by a roll of blanket or clothing. This position provides maximum support for the pelvis. The victim must be transported in this position. Fractures of the ribs commonly occur in people trapped in a demolished building or when they have been hurled off their feet by an explosion. Most rib fractures are depressed injuries, and care must be taken to avoid causing any additional depression of bone fragments into the chest. If the pain is slight and the person is breathing without difficulty, do nothing. However, if he cannot breathe properly without feeling intense pain, binding his chest may ease the pain and improve his breathing. The bandages should provide support for the chest so that it does not expand greatly when he breathes. Expansion and contraction are the causes of his pain. Bandaging should include the lower part of the chest because breathing movements are best controlled in this way. Once the victim has proper support from bandages, he will probably be more comfortable. Of all fractures which may occur in the body, the most serious are those of the spine and neck. You can see why by looking at the body from a side view. The vertebrae of the neck and spine compose a flexible bony tube, or vertebral column, which extends from the base of the skull to the base of the pelvis. The vertebral column has two main functions: to provide support for the body and to protect the spinal cord. The spinal cord extends from the brainstem down through holes in each vertebra. If the vertebrae are fractured and become dislocated, the spinal cord may be damaged or even cut in two. From this point downward, the body may be completely paralyzed. An injured spinal cord is one of the most serious and crippling of any injury you may ever see. If the victim is conscious, tell him not to move his head. Should broken bones cut the spinal cord, he might die within seconds. Prevent this by supporting his head with padded bricks or stones. Whether you suspect a fractured neck or a fractured spine, don't raise or twist his head and don't let him move himself. Keep him lying straight and still. Then call for assistance. You must have assistance to move him safely. If possible, 3 men to lift and 1 to fetch and place the litter. When you are ready to transport him, remove the head supports temporarily. Use a rigid canvas litter or one improvised with boards or a door. That will assure the best support for the neck or the spine. Be sure to place him so that his head, neck, and spine are in natural alignment. Then once again prop his head to keep it from rolling. Prevent him from falling or sliding. carry him carefully. His life is in your hands. Many fractures invite the risk of death. Immediate death from shock, or a more lingering death due to infection or injury to vital organs caused by sharp ends or fragments of bone. In most fracture cases, you can prevent this by knowing what to do and what not to do. Do not move a person with an uncared for fracture, except to drag him out of immediate further danger. Do not move a person with a suspected fracture of the neck or spine by yourself. If the patient must be moved, get help. Do not bind or splint any fractured part of the body so as to cause additional injury. It is just as important to remember the do's. Do immobilize fractures by splitting or binding at the place of injury before moving the victim to shelter. Do clean the wound in an open fracture by irrigating and dressing it. Do take steps to combat or prevent shock. And do suspect that a fracture may exist in any person who has fallen, been thrown, or hurt by a moving object, and act accordingly. By so doing, and not doing, in the emergency treatment of fractures, you will save lives, prevent deformity, and minimize suffering.